This is a lecture on the treatment landscape for children on the spectrum. We're going to review a lot of the different treatments that are available, not all the treatments, but a number of the different treatments that are available for children on the spectrum. Many of these are not necessarily treatments that are used by SLPs, but that are used by many of the therapists and staff that work with kids on the spectrum. So you'll remember from your class on language acquisition that there are a number of theories that guide our understanding of how children acquire language. These range from nativist perspectives and nurture kinds of perspectives. These may look a little different if you took my language development class last spring instead of in the fall, because I did change my textbook. So this diagram is created to try to help you understand the landscape of just language acquisition in general, because what we're going to do then is take treatments for kids on the spectrum and map them on to kind of see where they fit into these language acquisition theories. So there's the nature-nurture debate. On the left-hand side here, you'll see theories of language acquisition that are based on the principle of nature is primary. So there's a little brain figure. It's all about what you're born with. You're born with innate ability to learn language. The principles and parameters theory says that it's language, you have an innate language acquisition device, and that helps you learn language specifically. Cognitive theorists believe that it's not language specifically that is innate, it's cognition that's innate. And then language follows as children develop cognitive abilities. So one way that this becomes exhibited in the real world is that we often use, some districts, school districts will use what's called cognitive referencing as a means for determining who qualifies for services and who does not. So they will measure a child's cognitive ability and say, well, this child has this level of cognitive ability, and therefore we really don't expect language to exceed the child's cognitive abilities, and therefore if there's no gap between the child's cognitive abilities and the child's language abilities, then we would not find that child eligible for speech-language intervention, because basically they're performing to their maximum cognitive capacity, and we wouldn't expect language to exceed that. Now, there's some research that shows that there's some difficulties with how we measure cognition, especially in children on the spectrum, especially in children who can't really do some of the testing tasks that we want them to do. So we have to always be a little questioning about whether or not our cognitive score that we get for a child, is it really accurate? So that would be one problem with the cognitive referencing model. But that whole notion is that there's something innate about cognition, and your language will follow, and you'll learn language to the capacity of your cognitive ability. On the other side of this nature-nurture debate is nurture, right? So in a nurture philosophy, we believe that it's the environment that helps children acquire language. Now, behaviorists would say it's a stimulus response type of reaction, right? So the environment presents certain stimuli, the child responds in a certain way, and their response is then reinforced either positively or negatively, and if it's positively reinforced, then the child is likely to continue that behavior again, and if it's negatively reinforced, they're likely to not continue that type of response. So all behavior, including language, is learned and shaped in that way by the environment. Now, social interactionists believe in nurture as well, but they believe that all psychological functions are acquired through social interaction. So it's not a stimulus response issue, it's social interaction with more competent members of the culture, and that then leads to development and acquisition of language specifically, but also other skills like cognition and motor skills. Pretty much all kinds of development are guided by these social interaction principles. What we know to be true is that it's really not nature or nurture, that it's a combination of both. And so what the emergentism theory does is merge those two together and say it's not one or the other, it's both, and that there's a constant sort of interplay or interaction between a child's brain capacity, whether it's for language, innate for language, or innate ability for cognition. There's interplay between that and the environment itself, how the child is nurtured in his or her development. And so emergentism really brings those two things together. So let's talk about then the continuum of approaches for children on the autism spectrum. What you'll notice here is that we're not talking about nature versus nurture anymore. What we're talking about is these two different types of nurture philosophies. So behaviorism here on the left side, and developmental relationship-based treatments that are founded on social interactionist principles on the right-hand side. I want to be clear that these approaches are not discounting the role of the brain or the role of innate abilities. And so that we're not just disregarding nature, but what treatment programs have to do is figure out how to manipulate the environment in order to help a child learn better. We can't directly manipulate the brain. We influence the brain by either using some kind of behavioral intervention or developmental relationship-based intervention. Emergentism would then say, from the emergentist theory, they would say that these treatments, whether they're behavioral or developmental relationship based, serve to change the brain. They serve to help the brain develop and learn. So this is what we're going to do. We're going to walk through the continuum of behavioral and developmental relationship based treatments. What you see here on the left is that we have behavioral treatments that are very adult-directed, like discrete trials, low-VAS, applied behavior analysis. You have behaviorist treatments that move toward the center line. Those include things like verbal behavior, milieu teaching, pivotal response, picture exchange. The ones that move toward the center line are still solidly behavioral treatments. They're still quite adult-directed, but they share control a bit more with the child. So they'll do a little bit more following the child's lead, setting up the natural environment, doing treatment in a natural environment. Then we cross over the line and we head towards developmental relationship-based side of the continuum. And in this case, we have shared control, but veering on this toward the side of child-directed. So it's child-directed, but the adult still has some control. So these are the TEACH method, RDI, Relationship Development Intervention, JASPER, the Denver model, social thinking. And then on the very right-hand side, we see Hannon, floor time, CERTS, natural language acquisition, peer-mediated treatments. These are very child-directed treatments. These are some of the acronyms that you see on the previous slides so that you know what those mean. So coming from a behaviorist philosophy, remember B.F. Skinner, and the belief that language is a mental system that we cannot see, we can only observe behavior. So learning is really explained by input from the environment. We can only control what we are giving the child from the environment. So from the child's perspective, the child observes some behavior, they imitate that behavior, then they are selectively reinforced for that behavior, so either positively or negatively, and that through that process, their behavior is shaped. So what would treatment look like from a behaviorist philosophy? Well, um, we as adults would model correct verbal behavior, meaning language, right? It's just a different way of talking about language. Instead of using the word language, behaviorists will say verbal behavior because everything is a behavior, right? It's behaviorist theory. We would break down complex skills into smaller steps, and we would reinforce the child's performance. And so if they respond correctly, then we would provide positive reinforcement. If they respond incorrectly, we would provide negative reinforcement. Now, behaviorists would also say that we should seek to achieve errorless learning, so we don't let the child make a lot of errors that then require negative reinforcement. We work really hard to make sure that they can be successful, and then we can provide positive reinforcement. We don't, in this philosophy, allow repeated behaviors. We use negative reinforcement or redirection to try to ensure that children are not using repetitive behaviors because we see those as impairing learning. We might choose to use a token economy, so giving them reinforcers like M&Ms, or that they have to get so many checks, and once they get so many checks or so many stickers or smileys, then they can kind of trade those in for some kind of prize. We also would establish very explicit criterion for their success, and so we're expecting children to achieve a certain level of accuracy before we would move on. We also, in behaviorist treatment principles, we focus on the fact that it's very adult-directed. It's a one-on-one learning context with lots and lots of drill, and the adult is the boss. The child needs to comply with what the adult wants, and then they will get the reward. We then, as an adult, our responsibility is to mold and reward the desired behaviors. We're going to ignore or actively discourage undesirable types of behaviors, and we're going to really work hard to have success through prompting and modeling and hand over hand or hand under hand, or really constructing the task so that the child can be fully successful. Behaviorists would use minimal visual supports. So the focus is on oral language, natural cues from the environment, but not a lot of contextual support or visual supports. Behaviorist treatments are often very highly prescribed. They follow a specific teaching sequence. You need to achieve a certain level of accuracy on this target before we would move on to the next target. And we predetermine the criteria for moving on. So they must achieve 80% or they must achieve 90%. In terms of repetitive behaviors, in a behaviorist treatment approach, we do not want to allow self-stimming or repetitive behaviors to continue. And the reason for that is that they impair learning, and then the child acquires fewer skills, and then they continue to lack the pro-social behaviors that we want to see, and that then leads to, when they can't function well, that leads to more self-stimming, more repeated behaviors. And so we want to get rid of those repeated behaviors through either negative reinforcement or redirecting. We just disallow them to continue using those self-stimming behaviors. So I want to move us then to a little closer to the center. We are still talking about behaviorist treatments, but we're moving a little bit more toward the center. And so what you'll see is a move away from the really rigid adult-directed approaches to approaches that share control a little bit more with the child. Now, don't be fooled. The adult is still in control, but there's a willingness to kind of allow some shared control, and let's talk about what that would look like. Sharing control means that we might allow the child to make more choices, give the child choices to pick from. We'll have more activities where we will follow the child's lead. In this kind of a treatment, we will use the behaviorist techniques, but we will embed them into more natural context. So you might see a therapist playing with toys with the child. Now, it would be a very small set of toys, and it would be a contrived kind of situation, but it would be more natural looking than the more rigid left side of the continuum behaviorist approaches. What behaviorists in this set of treatments call this is natural environment training. They'll say we're doing NET, natural environment training. We're using the natural context, but we're also planning that context to make sure that we're able to address the skills that we want. So if we're playing with a little set of toy dishes and foods, we are asking the child to do certain things, and we're reinforcing their responses or prompting them to make sure that they can respond accurately and appropriately. So we're embedding that behaviorist kind of drill into a natural environment. In these types of treatments, there's also more of a focus on child initiation. So we're trying to get the child to initiate more, trying to encourage spontaneous communication so that the child has a little bit more, it's a shared control, right? So we want the child to be more spontaneous, initiate more, and that's helpful because that can be one of the challenges for kids on the spectrum, and if we don't help give them opportunities for that, they might not learn to do that. What do behaviorists do in order to build motivation? Well, for the most part, the primary thing is to establish some kind of reinforcement. So every child wants something. Conduct an inventory, figure out what they want, what they don't like, make sure that the reinforcers we're choosing are something that they want, and remember that what they want today might be a little different than what they want tomorrow, and so we have to establish what reinforcers they typically like, but then on any given day we need to figure out and kind of switch out what the reinforcers are so that they don't lose interest in them. Behaviorists would also say that a reinforcer doesn't have to be a tangible thing. It doesn't have to be an M&M or a Cheerio or a iPad time or whatever. It can be us. We can be the reinforcement. We can be playful. We can be animated. We can be fun. We can say good job. And those things can be reinforcers as well. So don't be fooled. It's not always about earning something. We can pair ourselves with the reinforcement. They also would build motivation by building anticipation, making the child feel excited and interested in what's going on. And we also build motivation by creating routines. So routines can help children be interested in something because they know what the routine involves, and so they want to participate. And so we build routines, and then we will sort of gradually change the routines to help us address different treatment targets. So how do behaviorists then deal with problem behaviors? There's a whole area of research and intervention called positive behavioral support. It's used by professionals, families, schools, districts. Entire districts and school buildings use positive behavioral support, and they use it for all kids, not just kids on the spectrum. And what they try to do is first make sure that the physical environment is as conducive to learning as possible. Two, make sure that classroom routines are well established and that everyone knows how to participate in classroom routines and what those routines and the expectations are. And three, that the classroom expectations are very clear, that the kids know what the teachers are wanting from them and what the expectations are. And the goal here is to prevent problem behavior. So when we say dealing with problem behaviors, what we really mean that we do first is ensure that the environment does the best job possible at preventing problem behavior from happening in the first place. So we want in a classroom a high rate of a lot of variety in opportunities to respond, and for kids on the spectrum it's really important that they have the ability and the opportunity to do something and to respond in the classroom. We want prompting to make sure that they're successful, so we don't just leave them up to their own devices. We prompt and scaffold and supervise and make sure that they can be successful quickly. A lot of praise or reinforcement when they are doing the right things. So if we praise and reinforce the right things really quickly, then we're less likely to see negative behaviors. And then providing additional support for children who have major violations of the expectations. And so that could be a child on the spectrum, but it could also be any child in the class who is having behavioral problems. And so we support that child, again, with the goal of limiting the frequency of problem behaviors so that we don't have to deal with those. When we're using a positive behavioral support approach, we would conduct a functional behavioral assessment, and our school psychologists and behavioral support people can help us do that. And the goal there is to identify the reasons for problem behaviors. Why are kids acting up in the first place? And then to figure out what are we going to replace those behaviors with so that they don't need to act up in order to get what they want or to be successful. And then we're going to figure out how are we going to teach those replacement behaviors. So are we going to modify the environment? Are we going to provide visual supports like picture schedules or first then boards, or sometimes we call them when you do this you will get that. So we have a when get board. We teach the specific routines, so we might need to really teach a child on the spectrum what the routine expectations are and how to follow the routine. We're going to give more choices so that kids have a little more control over what they get to pick. And we're going to use cues and prompts and support from other people in the classroom in order to help them be successful. The verbal behavior approach, and many behaviorists will use this terminology, and I want you to learn this terminology. So learn these 4 words. Echoics means imitations, manding is requesting, tacting is labeling, and intraverbals mean responding. And so if someone says, I'm teaching the child to mand, it means they're teaching the child to request. Now, SLPs typically use request and label and respond and imitate. Behaviorists tend to use echoic, mand, tact, and intraverbal. So you just need to be able to speak the lingo because it will go far to understanding each other. And again, isn't it all about being able to communicate with each other, right? So we're the communication specialists, and we need to be able to communicate effectively with members of the team. So learn these. You'll probably see these on a test. and it will go a long way to being an effective SLP. So what are some of the criticisms of behaviorist treatments? Well, behaviorist treatments lack a developmental framework. The curriculum is very rigid, very prescribed, and it does not typically follow what we know about typical development. So here's an example. In the verbal behavior program, there's the VB map, the verbal behavior map, where you map out the skills that a child has and does not have. And in the VB map, there's a requirement that the child needs to have 200 vocabulary words, and usually I think they're nouns. They need to have 200 nouns, and they have to be a certain level, like 80 or 90% accurate on those nouns. They have to be able to comprehend them and label them. And when they get to 200 nouns successfully, then we can move on to combining those words into two-word utterances. Now, if you are thinking about normal language acquisition, you might remember that children by about 18 months will typically have about 50 words in their vocabulary, and once they reach that threshold of about 50 words, then they start to naturally combine words into two-word utterances. So the normal developmental progression would be about 50 words, and the child starts using two-word utterances. So why then, in a behaviorist treatment, would we require that a child learn 200 nouns in order to then move on to teaching that child how to use two-word utterances? The other problem with this example, is the fact that we don't typically put two nouns together. We typically put a noun with something else, right? Like a verb. And so it's unusual for us to just say two nouns in a row. So we would need the child to have a greater range of vocabulary, not just nouns, if we want the child to use two-word utterances. So that's an example of how behaviorist treatments can lack a developmental framework, and that can actually cause some challenges in working together with professionals, because I've had SLPs say, why are they not letting me, and they will dictate to me that I cannot work on two-word utterances with this child because he hasn't achieved the criterion on the 200 nouns requirement. And so that's problematic, and that's an example of the fact that these treatments are not developmentally sequenced, and that's a problem. Another problem is that they're not intrinsically motivating, and if they're not intrinsically motivating, then they are going to have difficulties generalizing to everyday contexts. Now, the key here is that we don't get an M&M when we do things we're supposed to do in the real world, do we? And so initially maybe it helps a child to learn to do something, but eventually the child needs to be able to shift from getting a reward for doing something to being intrinsically motivated to do that thing. If we don't get that movement from extrinsic reward to intrinsic motivation, we're not going to get good generalization. And a major, probably the biggest criticism of behaviorist treatments is that they don't generalize well into everyday contexts. Another criticism is that they do not address sensory issues, and I will say that that's true in their pure form. So if you look at some of the behaviorist treatments, they don't include any sensory issue. They don't address sensory issues in the programs themselves. What I see, though, in many verbal behavior classrooms, for example, is that the teachers indeed do look at sensory issues and try to address sensory needs in children. Although they may not be included in many of these treatments, I think most professionals these days actually do in practice try to address sensory issues. Now, your textbook talks a bit about how language learning, focusing on this kind of behaviorist language learning can actually do harm to a child. And we'll talk more about, for our children who are echolalia users, when we force them not to use echolalia and we try to replace it with teaching them the 200 nouns, what we actually might be doing is stunting their language growth forever and not allowing them to continue on a path toward greater language learning. And so Marge Blanc takes a pretty serious perspective on this and suggests that we could actually be doing harm to some children by using these kinds of treatments. I give you some examples always of some videos that you could watch. I will use a lot of the Autism Navigator videos in class, and we'll discuss these principles watching those videos. But when you're studying for tests, it can be really helpful to pick some of these other ones that you haven't seen and go watch them and just think about, if you're watching Therapy with Sarah, what types of principles, behaviorist principles, are being used in those videos that can help you study and really learn the information a lot better. So I want you also to think about what you're writing in your notes. What are you taking from what I say in the audio lecture and writing down in your notes so that you'll have it later? And sure, you can come back and listen to this audio recording, but my guess is that you won't do that very often, maybe only for content that's really more confusing to you. But what I want you to be thinking about is how you're taking notes on what I say, and not just sitting back and listening, but actively trying to think about the content and what you could write down. So you could choose to just write something in your own words about what I said. You could add examples or ideas that I say that are not explicitly written on the slides, or if I use different words than I do on the slide. But figure out how you're taking notes so that you're really being an effective learner. We'll watch videos in class, and you can add what you see in those videos to your notes as well.